Okay, awesome. Welcome everybody. Hope you guys can hear me great. Welcome to our fourth workshop ever at HealthMUN. And this is most likely our final workshop event of the academic semester, but we're so excited to have everyone today. Today is extra special. And to those who are new here, welcome to HealthMUN in general. We are an international and intercollegiate nonprofit. We aim to teach students the relationship between today's world of health and STEM and what the United Nations is really doing about it today. While some of our workshops are about teaching students about model United Nations through debate and public speaking practice, we also occasionally invite guest speakers to come and share their work in the global health sphere. So during our last guest speaker event, we talked about the current state of healthcare in Somalia with Sirad Hassan, who was a PhD student in Harvard Chan School of Public Health. And today we are eager and honored to be with Dr. Khazana. She's an MD and founder of her maternal and neonatal health initiative. It's called the 2030 Nutrition Project. She's also been a previous speaker of multiple grand occasions, such as the World Health Organization's 10th Global Conference, the UN headquarters in NYC, and even an ambassador at the One Young World Summit in Manchester City. So please welcome Dr. Khazana.
Hi, thank you so much, Yasmin. Thank you for having me. Okay. So
I'm gonna let you share screen. Right.
All right.
How do I, okay, nice. I have to find my cursor. I don't see my cursor when I share screen. So I'm gonna do that. Hopefully that is not the button. Okay.
Okay. Am I able to share my screen?
Yes. Hopefully you're able to. I think I just
You should have permissions, yes.
Yeah.
All right. Thank you so much, everybody.
No, thank you. Thank you.
Okay. Can you see my screen?
Unfortunately, we can't see your screen. Let me see if I've given you enough permissions.
Okay.
Okay.
It should.
Are you able to see now?
It seems like not.
Let me try making you co-host. So sorry, everyone.
Sure, yeah, do that.
Okay.
Yeah, sorry about that.
That's fine.
It's always the Zoom technical difficulties getting in the way. Okay, how about now that you're co-host?
Let me try.
Okay, awesome. Yay.
Hey, I'm sharing
Let's
my
go.
screen. Okay.
Thank you
So,
so much.
hi, everybody. My name is Khazana Sihwaya, and I am the founder of the 2030 Nutrition Project. So in 2018, I went for a leadership program called the Study of the U.S. Institutes at the University of Delaware. And the program consists of women leaders and civic engagement and leadership. And after the program, is supposed to come up with a project. So I came up with the 2030 Nutrition Project, and here's why. So the mission of the 2030 Nutrition Project is to promote comprehensive good nutritional practices among pregnant and lactating mothers for improved health and well-being of children during the critical 1,000 days of life. So I come from Zambia, and during my medical school, I was interning and volunteering at a malnutrition ward. And one of the days while I was working there, a 2-year-old boy was brought in. And the 2-year-old boy was malnourished, his eyes were sunken, his hair was weak. And later on, after a few weeks of catch-up growth, the little boy was okay, he was running around. And after a few days, the little boy was brought back in. So when I spoke to the mom and said, why is the baby back in? And the mom explains to me saying, this is what we're feeding the baby at home. So they had this misconception that nutritious food is expensive food. And that's how I came up with this project to help these pregnant women and lactating mothers and promoting the good nutritional practices among them so that we avoid the misconception that nutritious food is expensive food. So back home in Zambia, we have 1.47, that's the nutrition budget under each child, and 35% of these children cannot meet their minimum required calories. So if we look at the nutrition at a global glance, 45% of child deaths are associated with undernutrition, and 13.6 million children under 5 were affected by wasting in its severe form in the year 2020. So the 2030 Nutrition Project also helps these mothers grow their own food and vegetables, because we discovered that providing food to these people and donating food was not going to be sustainable. So we taught these women how to grow their own foods during COVID. We taught these school-going children, we partnered with school-going children in the school feeding programs to also grow their own fruits and vegetables so that they can sell them and help eliminate malnutrition. So far, the 2030 Nutrition Project has partnered with the World Health Organization, which is a global strategy for women's, children, and adolescents' health. We've also partnered with the National Food and Nutrition Strategic Plan. And the reason it's called the 2030 Nutrition Project, it's because we're looking at the SDG number 2, which is zero hunger, and number 3, which is good health and well-being. And we're planning to end or eliminate at least 50% of malnutrition before the year 2030 in Zambia. So by 2030, we hope to reduce at least by half the proportion of men, women, and children of all ages living in poverty in all its dimensions according to national definitions. So what we do at the 2030 Nutrition Project is we have trained young people that we call nutrition ambassadors. So these may be nutritionists, students, and just the local people in the communities. We've also partnered with, so far we've partnered with 20 clinics. So we usually have our outreaches during what we call the Child Health Week in my country, where these women are brought in to teach them about nutrition and how to take care of their babies. So we also have capacity building, where we are helping these women grow their own food and encouraging the young people to take part in ending malnutrition. We also have policy advocacy, where we go on radio and TV, and where I'm invited to speak at so many events, where we're trying to incorporate more organizations, local and international, to help eliminate this problem. So we also have education and awareness, where we are educating the public because of the misconception that nutritious food is expensive food. So we're trying to educate more people to understand that you can grow your own vegetables in your garden, you can grow fruits, and you can buy food from the local market just to prepare a nutritious meal. It doesn't have to be something you have to buy off the supermarket or something that's going to cost more than you make. So it's easier to just maintain a healthy lifestyle. So far, so this picture, this is one of our nutrition workshops. This is where we show the women how to prepare food. So this was during a clinic outreach that we did in 2020. So far, 1,000 women have been impacted. So we have monthly cooking demonstrations across the partner clinics in Osaka, where we have partnered with the nutritionists and the nurses and most of the health practitioners that are working in these spaces. So like we said, we're working more on the preventive side rather than on the treatment. So we work with these mothers while they're still pregnant or while they're breastfeeding, so they already know the importance of good nutrition. So we also do dietary diversity, where we bring in groundnuts, we bring in porridge, and we show these women how to prepare these foods. We also have the macronutrient deficiencies. These are children that are almost entering into the 3rd stages of malnutrition. But before that happens, we're already advises women how to go about it in terms of breastfeeding and cooking these meals. So we have growth monitoring. So how we keep the statistics of this project is we make sure the ambassadors have a monitoring chart on how they see the progress of each child and after each visit, after the workshops we have with these women. So we can monitor how the child is growing and where the parents are going wrong, or if there's anything that they may need in order to reach that catch-up growth. So we also have oral rehydration therapy and also immunization, where most of these children come in vaccinated, and the meal preparation as well. So in this picture, we have our nutrition ambassadors. So they consist of students and students from colleges and universities. So we train them into integrated monitoring, accountability, and evaluation, and also learn the framework on nutrition. They also help mobilizing and organizing communities for nutrition, and they use media to raise awareness. Like we have TV, we have social media, and we have radio as well. So we're also helping develop policy. We've spoken to the Food and Nutrition Commission back home in Zambia, and we're also collaborating with the Ministry of Health as well. So we also develop policy recommendations to scale up nutrition financing in the national budget. So far, 5,000 lives have been impacted. So during COVID, we got a grant from One Young World, and most of the schools that had the school feeding program had shut down. So the children weren't able to attend these classes because they had no food at their school. So what we did is, when we got the grant, we donated food to this kitchen. So most of the kids were able to go back to school because of that. And because, like I mentioned earlier, it was not sustainable to keep donating food, and we wanted it to be long-term. So we decided to help these kids grow their own food. So we introduced the nutrition health in schools, where these 10 schools were empowered to grow organic local vegetables to supplement school feeding programs. So the teachers were trained to monitor and coordinate school gardening projects. As you can see, we're working with most of the high school students that were also helping with the gardening and monitoring of the plants that we had there. So we provided the tools, the seeds, and also other equipments that they needed to sustain this new nutrition health in schools. So also implementing partners, we have the Ministry of Agriculture and the local farming organizations that help us distribute these seeds and tools to the schools. And so far, our partners are the Department of States, at the state of the United States. We also have One Young World and the World Health Organization, and also the Zambian Ministry of Health. So this is just one of the babies that we had been taking care of since way before the baby was born, the pregnant mother lactating, and now we're just monitoring the growth of this baby. So this is just one of the lives that we've impacted with the project. So thank you. That's where the project ends.
Thank you so much. So with the presentation up front in front of us, did anyone have any quick questions about Dr. Khazana's work, anything she's spoken about, or for us? And you can either use the chat or you can unmute or anything like that.
Yeah.
Okay, I can read it out too. So Sarah, she said in the chat, is there a way to get involved in the USA as a student? Oh, so this is probably for HealthMUN, right? So for HealthMUN, I did mention that we're an international organization. Oh, sorry.
Sorry, I believe this question is directed towards Dr. Khazana for the organization, right?
Oh, okay.
Sarah, which one
yes.
are you
Okay.
referring to? Are you talking about
So
HealthMUN,
sorry.
or are you talking about the project that Dr. Khazana is currently
Yeah.
working on?
I was talking about the project Dr. Khazana was working
Okay,
on.
I'm so sorry.
No, you're
You're
okay,
good.
don't
Thank
worry.
you so much for the clarification. Dr. Khazana, it's all yours.
Oh, yes, I think there's a way to get involved. And I think we have a GoFundMe on our page, on our website, where students can donate, and also they can also start their own feeding programs. Maybe donate to a food shelter or a food bank, and just help grow their own food to inspire what these other children are doing, in where they're not able to provide their own food and services. But there's in the case of getting involved, I think raising awareness on social media and also donating to the GoFund. I don't know if that answers her question.
Hopefully
It did. Thank you so much. I appreciate it. Would you mind displaying on the page or like on the screen again, the GoFund link information?
Okay, so I'm going to share my website details with Yasmin,
yes.
and then she can add it to the post on her Instagram.
Absolutely.
Perfect. Thank you so much.
All right, thank you so much for your question, Sarah.
Awesome. Were there any other questions that I won't misinterpret?
I had a question. I
Awesome.
know food is the bare minimum, but are you teaching anything about, for example, like taking folic acid supplements or eating foods that are rich in folic acid for the baby's development?
Oh, Andrea, thank you so much. So that's under the immunizations, where these women come in for the Child Health Week. So we've also been touching base with collaborating with the nurses and the nutritionists. So most of the time our program is mostly focused on undernutrition and malnutrition. And yes, we've incorporated taking supplements for good health and nutrition. But thank you, that was a good observation.
Thank you.
Awesome. Were there any other questions? And you can either, type them out or just unmute.
Okay, it seems like Nadav has a question. I can read it out loud. Do you work with groups like Heifer International to merge nutrition/food access and
Like
financial
this.
independence?
It's like this meeting. It's like this doctor is like talking in it. Dr.
sorry?
Khazana.
Yes.
It's like a health Q&A thingy.
Oh, sorry. I think you're muted.
Okay,
No worries.
so I
Go
haven't
for it.
heard of the Haifa International, to be honest. I haven't heard of the Haifa International. Is it a food organization or?
It's a organization that provides families and communities with farm animals like heifers and goats. And the idea is that it's like a long-term investment where it allows them to be able to, produce dairy or to, breed the animals for offspring and then like develop their own small farm. And with that, make their own goods, develop their own business, and then also, with it have like a better source of food.
Oh, okay. Thank you so much. I think I'll look into it. I haven't seen it before, so thank you so much for that suggestion. I'll definitely look into it.
I think if I'm allowed to, I also wanted to add a question myself. So in like previous discussions you've seen where the 2030 Nutrition Project could have like contributed to a possible solution to these kinds of issues, do you think there's ever an area where the 2030 Nutrition Project couldn't solve, health promotion in the way that the World Health Organization sort of tries to? Or do you think there's anything that the 2030 Nutrition Project could essentially like improve upon in the future?
Oh, yes. So when we started the project, we mostly focused on the pregnant and lactating mothers. But when COVID occurred, we realized that it was hard to get into these hospitals and to access these women and children. So we ventured more into the schools where we started collaborating with the younger people. And I think that was easier because we realized that nutrition was it was not excluding the younger children that were already in the schools, because they were not having nutritious meals in the schools as well. And we partnered with the Ministry of Health, and we partnered with the government. So it was easier to see where the government had loopholes and how we would come in and just help the niche or the diverse group of people. So in terms of improvement, I believe that raising more awareness and just being sending more information and the importance of nutrition in these organizations, especially that back home, most of these flyers or anything are posted into English. So we have the ambassadors that can speak different languages, and just to help the locals understand for what really the project is about.
That's awesome. Thank you so much. I had a follow-up, but I'm going to put the chat first. Adnan, you can unmute if you want to. So sorry that I kind of jumped in.
If necessary, I can actually read Adnan's thing out
Okay.
loud because he says he's in a loud
Okay.
area. Okay. Is that okay, Adnan, by the way? Just making sure. Okay.
That's fine.
He asks, can you tell us more about how your involvement in international bodies like the UN have amplified your work? That's the first question. If you could
Okay.
answer that first, I guess, yeah.
Okay, so the UN, so implement international bodies. So so I realized that when I'm invited to speak with most of these events, I'm able to network with higher people in these higher places that are able to fund the projects. So I feel like those are some of the ways that it has amplified my work. And I've noticed that most people ask me to speak at these certain events after they've heard that I'm speaking at the United Nations. And also, do you believe the World Health Organization is? Yes, I think the World Health Organization is also playing a role into making an actual tangible impact on these issues, because like we've seen the 2030 agenda and global hunger and how they're trying to attack the undernutrition and these the third world countries that are not able to sustain themselves. I feel like they're also helping them get to that goal before 2030. I think
Okay.
I have another question from Eric.
Yeah, if you want, I could read it out loud for you real quick.
Sure.
Yeah. So Eric says, you said the US government was partnered with you guys. Could you explain more on how the US government is involved?
So we partnered with the US government of state. So that was after I went to the University of Delaware under the SUSI program. So those are the first, that's the first organization that funded my project. So because I'm a SUSI alumni, and if I want to ask for more funding, I have access to the US government of state, not the US government, but the US government of state. Yes. I hope I've answered those questions.
If there's no follow-up, I think so. Did anyone have any other questions to kind of unmute to or put in the chat?
I guess I have this one tiny question. I don't know if you kind of mentioned that with regards to this other answer, but in what ways do you think can individuals or small groups contribute to these goals from around the world, from like a remote location or something, without being part of like from a close quarters?
Okay, so
yeah.
I think they can help like donate food to a local food bank, I must say, or help these people grow their own fruits and vegetables, or you can even educate people, like raise awareness on how people can eat nutritious meals. So it's mostly just donating to a food bank, helping people learn about nutritious meals. And the idea of just nutritious food is expensive food, when there's so much nutritious food that can be found at these local supermarkets, and just help raise awareness. I think those are most of the key factors that anyone can contribute to without getting involved.
Yep. Thank you so much.
Thank you so much, Sheikh. Thank you so much for the questions.
If anyone had any other questions, Or if not, then I think, yeah, I think that pretty much summed up the Q&A panel then. Thank you so much, Dr. Khazana. Yeah, as someone put in the chat, great answers and an even greater presentation. Absolutely. Thank you so much for coming by. For everyone who's new here, if at all, if you want more events like these, if you want to see more work like this from amazing workers like Dr. Khazana, feel free to check out our link tree. I'll put the link in the chat. You can join as a member, you can come to our group me, and we'll have future events like these. Thank you so much, everyone.
Thank you so much.
One more thing, Dr. Khazana, if you want to put any email or any way to, I guess, contact you for anybody in the chat that might be interested, that'd be great as well.
Okay.
Yeah.
That'd be awesome. Yeah.
All right. So I think I can share everything with Yasmin, then she can put it on the poster. Is that fine?
Sure, that sounds good too.
I got you. Yes.
All right. Thank you so much. Thank you, everyone.
Thank you so much, everyone. Let me try to put the link in the chat. Okay, yes. So that's a link to our link tree. Thank you so much for coming, y'all.
Thank you.
Have a good one.